Foxy 107, 104, the real sound of the triangle. So July is Fibroid Awareness Month. So on the line to talk about it, I've got Doctors Stephen Loehr and Dr. William Pechter, who offer the uterine fibroid embolization procedure at Triangle Vascular in Cary. Thank you so much for joining us today.
Thanks for having us.
Thank you for having us.
So let's start with the basics. What exactly are fibroids?
So fibroids are benign uterine growths. They can cause heavy menstrual bleeding and pelvic pain in women. They're very common. Up to 80% of women may develop fibroid symptoms in their lifetime. And also many women suffer from fibroids every day with severe bleeding, low energy, and pelvic pain.
Okay, so how do we get that treated?
So we offer a procedure in our office called uterine fibroid embolization. But traditionally, the only treatment available for women was hysterectomy, which is a major surgery, complete removal of the uterus.
Mm-hmm.
But many women are not ready for this just yet. They don't like big surgical scars and prolonged recovery. And that's why we offer UFE, uterine fibroid embolization, which is a way to treat the fibroids without surgery. During Fibroid Awareness Month especially, we want women to know about this life-changing treatment that we provide at our office at Triangle Vascular in Cary.
So how is this procedure that you're talking about, UFE, how is that different from other surgical procedures used to treat fibroids?
Well, uterine fibroid embolization and myomectomy and hysterectomy, which are surgeries, are all treatments for uterine fibroids, but they differ in their invasiveness, the risks, and the recovery time, and the impact on fertility. UFE, or uterine fibroid embolization, is the most effective and least invasive global treatment, meaning treating all the fibroids for symptomatic fibroids. It's performed using conscious sedation to provide relaxation and pain relief. There's no general anesthesia or deep sedation required. There are no scars as with surgery, and the recovery at home is in a matter of a few days. The risks of infection and blood clots are negligible compared to surgical treatments. UFE also allows patients to keep their uterus and preserve their fertility. With surgery, such as hysterectomy or open myomectomy, patients have a larger scar and prolonged recovery with significant time out of work. While myomectomy can be done laparoscopically, it may be limited in treating the uterus with multiple or large fibroids. With hysterectomy, the uterus is removed. However, patients may develop problems later related to surgical scars called adhesions or pelvic floor dysfunction.
When I hear you all talk about it, to me, this almost sounds like a no-brainer, right? It's easier, the recovery time is better, and it can treat all of the fibroids. What else do we need to know?
That's exactly correct, and that's why we want women to know their options during Fibroid Awareness Month, that, we're interventional radiologists who perform this procedure, UFE, and other doctors don't really know about this procedure. We want patients to be aware of the option that this is a great alternative to hysterectomy.
And what exactly is an interventional radiologist, like you just mentioned?
Good question. Interventional radiologists are highly trained medical specialists who use advanced imaging guidance, and that includes things like ultrasound, CT, MRI, or fluoroscopy, to perform minimally invasive procedures to diagnose and treat a wide variety of medical conditions in nearly every organ system. It's often referred to as surgery without a knife, since it relies on small needle punctures rather than larger surgical incisions.
So I feel like I'm learning a lot today. So if one of our listeners is interested, you caught their ear when you said fibroid, and they've been going through a lot, and they've been trying to figure out how to deal with their fibroid issue. How do they get in touch with you so that they can learn more about the procedure and how it might affect their lives?
You can contact us at any time at Triangle Vascular. We have more information online if you'd like that, or our phone number 919-677-9729.
And what's that website?
Yeah, trianglevascularassociates.com.
All right, fabulous. Well, doctors, thank you so much. This is a perfect time, Fibroid Awareness Month, to have this conversation. Thank you, Dr. Loehr and Dr. Pechter and Triangle Vascular and Associates in Cary for sharing this information with our listeners today.
Thanks for having us.
Thank you very much.